Good afternoon and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communication Service and Multicultural New South Wales. I'm Jesusa, Helaratne, Deputy Director of the Multicultural Health Communication Service, and I am your moderator for today and for these sessions. Thank you so much for joining us. We're honored to have joining us this afternoon, the Honourable Minister for Health, Minister Ryan Park, and he'll be joining us in a bit. But we're so pleased to have with us again the Chief Health Officer, Dr. Kerry Chant, joining us. Thank you so much for being with us.
I think Minister Park just joined online.
Yes. Hi, Minister Park. How are you?
Hello, everybody. Thanks for having me.
Thank you so much for joining us. It's a pleasure to have you with us today. Thank you. And as I said, would mention Dr. Kerry Chant is with us again. Thank you. We have today some issues and updates from COVID-19, influenza, and other public health matters that Minister Park and Dr. Kerry Chant will be providing us today. But first, I would like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders past and present and Aboriginal communities and elders and colleagues who are joining us today. We also pay respects to elders and leaders who are multicultural communities who are represented in this session. We have 30 minutes today, and hopefully if the Minister and Dr. Kerry Chant will allow for a few more minutes over time to ask your questions and for the updates to be provided to you. As always, we ask if you can please keep your microphones on mute and ask your questions on the chat. We want it to be a lively discussion, so please let's hear your thoughts and add your questions and information that you may also have on the chat. But we'll start now. Minister Park, how are you? And thank you for joining us.
Thank you for having me. It's fantastic. It's a couple of weeks into the job and I'm loving it.
You did announce today that the New South Wales is transitioning away from COVID-19 PCR testing, and that's a big announcement.
Yeah, it is. Dr. Chant and I made an announcement today that we're moving away from those drive-throughs and set up clinics for the PCRs and focusing more on making sure that people are doing those rapid antigen tests, and Kerry and her team are pushing those tests out into the community so they're free of charge wherever possible in places like Service New South Wales and with councils, etc. But we also understand there are going to be at times people who will need a PCR test. And Kerry talked about at the press conference the importance to have a plan to go in and engage with your general practitioner, your local health advisor, and talk to them about if you do have COVID, what will you need to do, how will you go about that, making sure that your pathology forms are ready to go to make it as easy as possible. So we understand that people will still need to do that. They'll be able to do that through a GP referral and have that done free of charge where that's appropriate. Because that is important, particularly to get that early antiviral medication, particularly for older people, in as quickly as possible after the diagnosis and in those early stages. So we understand that that's an important part, but we've also got to make sure that we're spending taxpayers' dollars and allocating taxpayers' dollars appropriately. And we just haven't had the big increases or uptake in testing at these sites for some time. And Kerry's recommendation, one that I support and one that we had a really good chat about, was to go down this path.
Thank you, Minister. And Dr. Kerry Chant, these RAT tests are so crucial, and we should be reminding people that it's still the way to test.
So for most people who have respiratory infections, so if you've got a cough or a cold or a runny nose, and you don't have particular risk factors, the messaging is clear that just to stay at home if you can. If you've got to go out, wear a mask. We don't want to spread those viruses. At the moment, Jess, we've got both COVID, influenza, and another virus called respiratory syncytial virus seeing upticks in the community. So we really don't want you spreading those diseases to your colleagues as well. So if at all possible, the main message is probably whether it's COVID or flu doesn't make any difference if you're not going to have any antiviral treatment. What's most important is that you take those proportionate measures to make sure you're not passing on the virus to others. We particularly want to message, don't go into aged care or visit sick loved ones in hospital if you've got those symptoms, even if you're testing negative on a COVID test. Now, in terms of rapid antigen tests, we would love everyone to have a pack of those at home. It's still useful, particularly if you want to have that added measure of testing yourself before you're going in to visit particularly sick people, just to know that you're protected. Sorry, but got a bit of an itchy, scratchy throat. So having access to those RAT tests and using them, but particularly for people that are elderly, eligible for antivirals. Sorry, just elderly people who are eligible for antivirals. It's really important that you have a testing plan. Now, do the rapid antigen tests, immediately get it out of your cupboard, do the rapid antigen test. If that's positive, immediately contact your healthcare provider. So if you're eligible for those antivirals, you can get them very quickly. For those, if it's negative, you still may have COVID because the rapid antigen tests are not as sensitive, don't pick up the disease early enough. And that's where your GP may well have recommended you to have a PCR test in that circumstance. And it would be great as you're going in to get your flu vaccines or checking that you have your COVID, you're up to date with your COVID, that you talk to your GP about what is the plan for you if you get those symptoms during winter. And they might say to you, here's a pathology test form. If you get cough or runny nose or feeling unwell, I would like you to have a PCR test. So do that rapid antigen test, act on that if it's positive. But if it happens to be negative and your GP has indicated you need a test because you will be eligible for antivirals, go and get that test.
Thank you, Dr. Chant. And Minister Park, you're saying that all the RAT tests will be accessible for communities as well. That continues to provide, that New South Wales continues to provide free access to RATs?
Yeah, we want to make sure that we are getting out the supply that Kerry and her team from the public health units have and have stored during COVID. And we obviously ordered lots of them during COVID. That was a sensible response. And whilst we haven't used any, what we've got now is we want to get them out. Dr. Chant made a point today at the press conference that many of them have pretty long expiry times. So we've already sent them out to local councils. We've sent them out to Service New South Wales. We'll continue to try and get them out to clubs and schools. We've also got to focus on trying to make sure that local members of Parliament, there's been a new Parliament formed over the coming weeks. I want to make sure that my colleagues who have a lot of interface with the community also have those level of rapid antigen tests available to give people. The bottom line is we want to try and do our very, very best to make sure people can access rapid antigen tests easily, cost effectively, where possible free of charge, and they have some in their home and as a part of their plan, if they do get COVID or a respiratory challenge, that they will be able to work through that and use those going forward.
Rhonda Katan, Minister and Dr. Chant, Dr. Rhonda Katan, CEO of Arab Council Australia, joining from the Darug land. Quick question, when will the PCR hub stop? Sorry, she missed a date, and that is in May.
That's in May. It's a few weeks away, just to know for that transition to occur. But just, we'd also like to hear from individuals if you've got any ideas of how we can get those rapid antigen tests out.
Yeah.
So clearly we have used local councils and Service New South Wales sites, but if members of the community or got community organisations that would like access to the testing to distribute, we would really be open to any suggestions to consider to discuss with the Minister.
Thank you. And Minister?
Yeah, exactly what Dr. Chen said. It's absolutely critical that we get these rapid antigen tests out into the community. We don't profess to say that we've sent them to everyone. So if there are individual organisations or groups or cohorts that you think could do with a particular amount, please let us know. We want to try and make this as effective as possible. One of the ways in which we can play a role is making sure that these kits are available out into the community. And Dr. Chan has done a fantastic job in already trying to get them out, but there's obviously other outlets and other opportunities to do more. And as we go through this transition period, we want to try and get them out as quickly and effectively as possible.
In the chat, we can see some good suggestions. We have engaged with TAFE, so that was great that got the thumbs up, but we'll capture some of this, but please don't hesitate to send it in separately, and we'll explore those avenues.
Yes. And it is important, the questions that's coming in. Thank you so much. One of the questions, Dr. Chant, was if someone had COVID, one of the colleagues of Dr. Nargis Banu said that one of his colleagues tested positive today, and we worked together yesterday, sitting next to her. Should Dr. Nargis stay home?
Well, I think Dr. Nargis should be very vigilant for his symptoms. We're all going to be, I think, we're going to have those encounters with various individuals. A bit of it depends on your personal risk in terms of whether you're vaccinated or not. Clearly, you're at risk if you spend a lot of time indoors with the person, and it depends on whether you've had recent COVID recently. So rather than give specific risk assessment around that, the general principles would be your risk is elevated. So take those proportionate measures. You might just want to be particularly vigilant. You could use RAT tests to know that you're negative. Depending on the nature of the work, it was if a clinical practitioner is Dr. Gargas seeing patients. So you might want to take a higher level of protection if you're going to be interacting with patients. So yes, that exposure's got to be taken into account, and then it might be that you wear a bit more protection. You have monitored for symptoms using the rapid antigen test, but again, it depends a little bit on the sort of activities that you're taking and how that works. So rather than give specific advice, happy to take a call and go through that separately or provide that advice. But just as a general sense, obviously, if you spend a lot of time in an enclosed environment with an individual, your risk is increased. You're therefore at risk of catching COVID, but there's a general increase in the risk because as many people we're interacting with. So it is around taking those proportionate measures.
And Dr. Chant, we have all that practice with all of these habits and practices that we've learned through the years to be able to practice all that.
That's correct. And look, probably the key thing is if people have got symptoms, it's really very important that people limit your exposure. Stay at home when you've got that cough, work from home during that period. It's those simple steps mean that we don't spread our viruses around, and that keeps the community safe, particularly being conscious of not spreading those infections in very sensitive settings. And when we mean those sensitive settings, we mean aged care, disability, our hospital system.
Yes. Thank you, Dr. Chan. And Minister Park, we are promoting and we're still encouraging people to get vaccinated.
Well, it's absolutely critical. Dr. Chant and her team now have been saying for some time that it is one of the best ways in which we can prevent getting very, very sick and being forced to go to hospital. I can't stress enough the importance of making sure that you're keeping up to date, your communities are keeping up to date with vaccination. It's a small thing, but it's an important thing that we can do not only to protect ourselves, but it also protects vulnerable people who we may come interaction with. But it also, really importantly, also helps our frontline healthcare workers, which are under enormous pressure, our hospitals at the moment. We know during the busy flu and winter season, that pressure increases. This is a small way, a small part, but an important part people can play. And it's absolutely critical that we listen and heed the advice from Dr. Chant and her team, advice that has helped protect our community now for some years. And we make sure that we don't get lax about that, but we keep up to date with our vaccination. And the beauty is with a flu vaccination, you can also get COVID as I did last week with Dr. Chant at the same time. And it's an opportunity to get that double protection, keep up to date with your COVID booster at the same time, getting that important influenza vaccination.
You just mentioned the influenza vaccine, and that's important. Dr. Chant, you can't get the vaccine together with your COVID-19 vaccine?
Yes, you can get, and the minister and myself did actually have personal experience. So we had it, one injection in one arm and the other vaccine in the other. So I had my flu here my COVID here. And it was convenient. We didn't have to go back for the two visits. It is very safe and effective to have it concurrently.
And the priority groups, Dr. Chant, for influenza vaccine.
So I suppose one of the key focus, and I just draw your attention to the poster we've got in our background, which is saying influenza is serious. In the community, we tend to use flu in a colloquial way to describe any time we've got a bit of a runny nose, sore throat, all that mild, sort of quite a mild illness. But influenza is actually quite serious. And one of the key points we want to emphasize this year is that, in particular, the 6 months to under 5 years of age is a group that is at risk of severe influenza. It accounts for a number of hospitalizations every year, and occasionally, tragically, we have deaths in children from influenza. It's an area where we do really well in vaccinating our childhood cohort. We're very good every year at vaccination in Australia. It's one of our key strengths, but we haven't managed to get high levels of influenza uptake in that under 5. So this year we really want to emphasize the importance of vaccination. Yes, it is an annual vaccination, but it is an important element of keeping children safe. Also, the other age groups are very much over anyone who wants a flu to be protected from flu over 6 months of age is recommended. But then we have funded vaccine that is provided to a variety of groups, and that's Aboriginal and Torres Strait Islanders over 6 months of age. As I've said, the 6 month to under 5 years for children, pregnant women at any stage of pregnancy, people aged 65 and over, and then people with underlying medical conditions. So if you've got 6 months and over who have cardiac disease, respiratory conditions, conditions that compromise your immune system, renal disease, any particular cancers, hematological disorders are recommended for vaccination. So there's actually free vaccine provided to a broad range of individuals, and we would urge you to get vaccinated. And that vaccination is available for everyone over 5. All of those groups can get it in pharmacies as well.
Yeah. And as you mentioned, how important are those roles of the pharmacists and GPs, Minister Park, that now it is accessible through these areas and services and centres?
Well, it's really critical. Kerry and the team in the public health unit know how important it is for all aspects and all arms of health professionals to play a role in this space. And pharmacists play a really important role. They've built up a level of trust in the community where often they are the most frequently accessed health professional for many of us right across the community. And particularly in certain communities, there's a real sense of trust and loyalty and understanding with their local pharmacists. And they play an important role and part of the solution into try and maximise the accessibility for people to be able to have those important vaccinations. And it just gives people another option, another opportunity, more accessibility to be able to take up this important opportunity and get vaccinated.
And Dr. Kerry Chant, with these pharmacists, and there's no cost, as you said, there's some costs at some point, but there's those that are available for other priority groups.
So the Commonwealth Government funds the vaccine free of charge for the groups that I indicated. Both the GPs and pharmacists might charge an administration fee. In the order, it's generally in around $20 to $25 for that vaccination fee. And obviously bulk billing GPs will mean that the service can be accessed for free. So there's a range of access points, but for those, there may be an administration charge, but bulk billing GPs would be providing the vaccine free and the service free.
Thank you, Dr. Chant. And we've seen in the chats that they're really appreciative that the pharmacies, that it's available, and also that the rat tests are available and there's access to those. And they have mentioned some addresses where we can send those rat tests. So thank you for that. But one of the things that we wanted to ask as well is, this is a time where a lot of people get anxious with so many key health messages. Okay, it's time for COVID, it's for influenza. What should people be doing in terms of just catching up with each other and letting people know that it's okay to ask and go to your GPs or ask for help?
So I would just encourage everyone to have a good primary healthcare practitioner and a GP. It's really important that we focus on preventative health, and we would see vaccinations as being part of that preventive health. But there's many things like screening, and I know we've discussed that with you before, making sure that your health screening's been done, that your blood pressure's been checked, your cholesterol's been checked, that we actually focus on wellness, and your primary care practitioner is well placed to do that sort of health check. And so I would urge everyone ahead of the season to book in for their flu, but also potentially book in for another appointment, which is really about focused on their health. We really do want to move into a proactive management of prevention, and to get those when you might be having signs of ill health, that they're detected very early, because we know for many conditions, if we can detect the condition early, we can treat it effectively, we can manage it effectively, and there's a much better wellness outcome. I'd also like to put in a plug for just getting more physically active. Let's take the fact that we have generally a mild winters in New South Wales. Let's just still take very physically active, engage socially, really attend to our mental health. So I would like to see sort of 2023 as being a focus on wellness. And whilst we've got to confront winter, and we know there's more viruses around, we really do have the tools. We know how viruses are spread. We really know how to prevent the transmission, and we're just wanting people to just be a little bit mindful, but really focus on those broader health prevention messages.
Yeah. And Minister Park, being the Minister for Regional Health as well, encouraging people to visit and go around the area, keeping each other safe, but also making sure that we're traveling and keeping each other safe.
Yeah, it's absolutely critical. Kerry is spot on. 2023 has to be a year where we also focus on getting well again. And one of the things that I know Dr. Chant spoke about to the community during those very challenging COVID years, particularly at the peaks, was also making sure we're still taking in consideration some of those important health things that we need to keep an eye on. So our blood pressure, our sugar levels, if we need to check on a skin condition. Please don't ignore symptoms, don't ignore signs of things. It's perfectly right to go out and about now. What we want you to make sure you're doing is getting and attending to those health appointments that people may have put off. So if it's screening, it doesn't matter what it is, it's really, really important that communities now use 2023 as an opportunity to restart that and to make sure that they keep up with those appointments, and making sure that no matter where they live and they're out and about across regional or rural New South Wales, that's a factor and that's an important consideration, because that has to be where we start to focus on. The world can't revolve around this virus called COVID. Kerry is spot on. We have to start to also focus on our general health, mental health, and overall well-being. And I hope people use 2023 as an opportunity to start to focus on getting healthy again, outside of what has been a very, very difficult period of years.
Yes, and there's also support for language support. I think that's so important for us to emphasize, that there is support for people who speak a different language and who need information in multiple languages. And there is that interpreter services for healthcare interpreter services, and the Tish National 131450. And Dr. Chant encouraging people to call Health Direct if they needed to.
So I really would encourage community groups to push out the message that Health Direct is there to help people navigate the system. And there's a lot of different services that are being bolted onto Health Direct. The minister, I think, announced a service called Virtual Kids that is linked in through Health Direct, and there's very other ways in which Health Direct is enabling and filling gaps that people might have, particularly on weekends or after hours when their own primary care practitioner is not available. So I think it's really important we disseminate that number, and also the way that you can access that number through the Tish translator service, so that you're actually connected to care. I think that we want to make connections to care easier.
Yes. Yes, that's right. So the number is called Tish National 131450, and ask for Health Direct on 1-800-022-222. So that's the information. Also, in terms of mental well-being, there's a transcultural mental health line where people can call as well, isn't it, Dr. Chant? If you're feeling concerned and anxious, or if you just wanted to talk to someone in your language, you can talk to on the transcultural mental health line.
That's correct, Jess. And I think we probably need to do a better job at packaging some of these services so that they're very much accessible, and just want to acknowledge the work that you do all the time in trying to make those connections. But again, any suggestions about how do we present this information in a more accessible way, we're really open to that.
Thank you, Dr. Chant. There is one question here by Bushra Alubaidi. How can the pharmacist act in case of an anaphylactic shock due to any vaccine, although it is very rare?
So as part of the training, the pharmacists actually have to train in anaphylaxis management. So they have to be skilled in that. They have to have adrenaline on standby, and they have to have the protocols, and they have to know how to manage that. And they also know how they're going to access more definitive care after they've administered that immediate first aid. So that's part of the training for the pharmacists. And recently, we've also allowed pharmacists to vaccinate for a range of other conditions. One of the examples would be Japanese encephalitis. And we've seen a lot of vaccines delivered through pharmacists for Japanese encephalitis. So we do see that being one of the core competencies of GPs. It's been one of the strengths of our system. We know many people go and access their local pharmacist, and their local pharmacist often maybe speak the language of the person, and that again assists in accessing care. So yes, but no, they're very competent in managing anaphylaxis, and yes, it is rare, but we have to be able to respond when it occurs.
Thank you, Dr. Chant. And there's a comment by Rhonda. I hope Health Direct is more responsive than it was a year ago at the peak and height of COVID.
Look, I think there's been learnings for all of us through COVID, and I think one of the strengths is for Health Direct to grow and strengthen. But again, any feedback, I think we really do need to hear any feedback about how we can make our services more accessible. But I can imagine at those times Health Direct was overwhelmed, and I assure you that there's a lot of work being done to work as part of the service system to really strengthen access.
Thank you, Dr. Chant. And Minister Park, they said here that maybe we can distribute rat tests at the train stations. So just a thought there by Sam Seo.
Yeah, look, I think Dr. Chant and I are open to all ideas. We don't want to see rat tests expire, okay? Dr. Chant and her team, through the government of the time and day, worked really hard to make sure that we had in this country, and in New South Wales in particular, adequate resources for people to be able to properly test. And as we move to this next phase of managing COVID and living with COVID, we want to make sure that they're out of New South Wales health storerooms and into the community. So can't emphasise what Dr. Chant said enough. If there are some ideas, straight away after this, we'll start to package them up. And also, if there are some specific issues that you think we can do better, please, I'm still in the early stages of this role. Dr. Chant is someone who I deeply admire and respect, and I know that we would always want to be trying to do better when it comes to the communities that you're represented by and that you represent, and that's something that's very near and dear to my heart. So please, if there are things that you think, geez, I don't know why we do this, or I wonder why we couldn't do that, please come forward, let us know, and we'll do our very best to try and make improvements wherever possible.
Thank you, Minister Park. And there is a comment by Carmen Lazar. She's a Syrian community. In order for us all to have the same message to our communities through media, it's important to have a script and that's an information in language. So we will work hard to do that and to provide that information. There are resources translated in different languages. And for Influenza is Serious, social media tile is going to be available in up to 62 languages. And we will send that out to you in the next few days, where Multicultural New South Wales, Multicultural Health Communication Service and the Ministry of Health is working together on that. We are running out of time, but one last question, Minister Park, for you in terms of virtual kids and virtual care and that program for the communities and its importance.
Well, it's absolutely critical. What I said in the very first few days, I wanted to have a look at programs that were not only taking some pressure off our emergency departments that are under enormous pressure at the moment, but also providing a convenient and accessible pathway and making sure that people are getting the right care at the right time at the right place. And this is an example of that, where people actually can call in, clinicians and paediatricians can make assessments with children and to children, for children and their families, and make a determine whether it's, yes, come on into an emergency department, we think it's at that level, or no, let's do this, or let's get in contact with another healthcare professional to be able to provide that care in a different way. I've got 2 young children. They're rouseabouts and they've spent a bit of time in emergency departments, but just the other day, my wife actually used virtual kids to help my son who had a bit of a fit after fainting, and it was fantastic. Provided some reassurance, didn't have to spend a huge number of hours in an emergency department. That's not good for the parent, not good for the children, and also not good for our healthcare system or our healthcare professionals if there's a better way in which they can be treated. So we'll continue to look at those types of innovative solutions around delivering healthcare where we can do it effectively and at the right place, right time, with the right people.
So much, Minister Park. And were there any last words? And I hope your son is well, but were there any last words that you have for the multicultural media and the health workers and also the community leaders and members that are online today?
No, I just wanted to take this opportunity in my first media conference just to thank you and the communities that you represent for going through a very, very difficult few years. Everyone across New South Wales has played a role in trying to keep everyone's self safe, and your communities, as much as anyone, played a really, really important role. Thank you for being leaders and communicators within your communities. That's really important. But for you to do that job effectively and well, and for us to make sure that your communities are safe and getting access to information in a timely manner through an effective way, we need your feedback too. So I emphasise, if you think there could be something better that we're doing, please let us know. We are committed to making sure that everyone across New South Wales, no matter what your background, gets access to good quality healthcare, good quality health information and advice, and feel supported by the health system. So I look forward to working with you. I look forward to being a regular on these discussions. And a big thank you to Kerry and her team and the entire healthcare staff across New South Wales for what has been a very challenging few years, but have really, really put us in good stead in terms of protecting our community during these challenging periods.
Thank you, Minister Park. It's good to have you online, and we'll make sure that we, as you said, we're going to make you a regular and have you on these sessions as many times as possible to answer questions.
Thank you.
So thank you very much, Minister Park. And Dr. Chant, was there any last words that you'd like to impart to the communities and to the media?
I think just to echo Minister Park's words, this is a prevention. We really want to have a re-engagement and prevention focus, but we also do want to hear how we can better support the community with information. Yeah. And there's probably some services that we spoke about today that we will work, I think, to package up some information in addition to what you said, Jess, about putting out advice about the influenza program.
Thank you so much, Dr. Chant. Minister Park, Dr. Chant, thank you again for joining us, and to you all for being with us today. And we will be back in another fortnight, but we appreciate you and your support, and for delivering these key messages to your communities. If you have any questions or any other health topics that you'd like us to present in this media forum, please let us know. And as Dr. Chant said, and Minister Park, we're open for any suggestions, and we're happy to consult with the communities. And for that, we'll see you next time, but we will have this recording ready for you on the New South Wales Multicultural Health Communication Service website, and will be sent through email to you. And please share with your communities. Meantime, have a great afternoon, and we'll see you again next time.